Hello everyone and warm Eid greetings to our Muslim brothers and sisters around the world. You're watching Hard Copy coming to you from our studios in Abuja. I am Terry Ikumi. Now I know it's celebration season, but the conversation still needs to happen because barely a month after their last indefinite strike was called off, doctors under the umbrella of the Nigerian Association of Resident Doctors are back in the trenches. And sadly, it is for the same reasons that they had proceeded on strike on the 15th of June, which include non-payment of the revised hazard allowances for COVID-19, the shadowy nature of their life insurance scheme, the non-implementation of Medical Residency Training Act, and a host of other demands. But with the recurrent nature of these strikes, do they not begin to lose their effectiveness, especially as the country is still in the middle of a pandemic? Well, let's find out. The president of the National Association of Resident Doctors, Dr. Aliyu Sokomba, is our guest tonight on Hard Copy. Dr. Sokomba, welcome to Hard Copy.
Thank you very much.
And it's nice to have this conversation with you in person because I recall that we've spoken over the phone over some of these issues.
Yes.
And that was before the strike of last month was called off. But it's worrying that we're still at this stage of our conversation, regardless of being in the middle of a pandemic. And the resident doctors have complained bitterly that the government has refused to honor its part, its end of the agreement. But what's more important to me right now is this. On what basis did you call off the strike last month?
Yeah, the strike last month was suspended, not called off, on the premise that the government had initiated some processes of getting our concerns addressed, and it will amount to us being insensitive to remain on strike while the government has demonstrated commitment to getting the concerns addressed. Though we entertained the fear that the government will abandon the processes immediately our strike was called off, but we felt for everyone to know we needed to give the benefit of the doubt, and we were not surprised eventually when the whole process were abandoned just immediately our strike was called off.
What concerns did the government begin to address, and at what point was it truncated?
Well, we were told that the president needed to sign the revised 2020 budget, and there was nothing that could be done until the budget is signed. That's with regards to the medical residency training funding. And so we waited, and the president eventually signed the budget, and we never had anything afterwards. And the second thing that was initiated at that point...
just a second.
Yes.
What were you hoping to hear after the budget was signed? I mean, the budget was only signed middle of July?
Yes.
Early July?
Yes. The whole processes of getting the payments effected has been concluded. All that was being awaited then was the signing of the budget. And so we had expected that after the signing was done, that the immediate implementation, that's the payment of the medical residency training funding, will commence immediately. And
but don't you think it's too soon? I mean, that budget was only just signed a few weeks ago, and monies have not been released, except you're talking about processes that have not commenced. Have the processes been started yet?
Well, immediately the budget was signed, we had expected that the ministry, our supervising ministry, will have initiated, written at least a correspondence to the Ministry of Finance, bringing it to their attention that there's a fund that is expected to be disbursed. And I think all of that needs to be initiated before eventually we will know that the reason why the money is not coming is because monies have not been released. But even if eventually these funds are released, it won't be paid because the processes that will lead to the payment has not been initiated.
So your grouse is that communication has not been established between you and the ministry?
Not me, between the ministry. We've already concluded our discussion with the ministry. The ministry was supposed to take it up from there and communicate with the finance that will eventually make the payments when funds are made available to them.
But before issuing this threat, did you reach out to the ministry on this particular issue?
Yeah, we have been reaching out to the ministry on not just this issue, on all the issues we have.
No, I mean this particular issue. I want us to take it one step at a time. This particular issue.
This particular issue, we were supposed to have a meeting with the stakeholders, the National Postgraduate Medical College that regulates the residency training program, the National Salaries, Income and Wages Commission, and other stakeholders, so that the processes of getting the payment effected will commence. And that was initiated and then was adjourned, and then we were hoping that the follow-up meeting will come up, and so we will conclude on the arrangement for the payments. But that never happened, and we have continued to reach out to the ministry, and unfortunately we are still stuck where we are.
What's the state of the hazard allowance? Because I know that during your press conference you mentioned that it commenced and was stopped at some point.
Yes.
How did that go?
Yes. You recall that the initiative to pay the COVID hazard allowance was government's initiative, which we acknowledge and commend them for. And being a promise, it is they are duty bound to fulfill whatever agreements they have reached with us. And based on the agreement we had then, it was agreed that the federal government was going to pay the hazard allowance for 3 months at the first instance, and then subsequently another 3 months before eventually an agreement on the permanent and lasting hazard allowance will be reached. And this meeting held in March. It was supposed to take effect from March, but eventually they claim it's supposed to take effect from April, which we never went into any arguments with them on. And then the payments commenced for April and May. It was paid at the same time, but even the April and May was not paid to all institutions and all doctors and other healthcare workers that need to get the payments. And then we have continued to reach out to them to let them know that the payment has been suspended. We still have a lot of people who are yet to get the just April and May payment effected. You will see that we're already ending July, and so we have not been paid for June. We have not been paid for July, and we are not getting any information as to the status of when the payments will be made.
What's the feedback you get from the government on this?
Yes, the feedback is that they underestimated the beneficiaries at the first instance, and so the money they had planned to use to make payment, to offset the payment, has been exhausted. So the whole process of getting more money will have to be initiated. And we are concerned that until and unless we continue to demand for it, we may never get the money.
Well, it does sound like a logical explanation, doesn't it? That the government has said, it doesn't? The government has said that we underestimated the payment,
yes,
but we're in the process of trying to reevaluate everything. So one would expect that you would hold on and see how far the government can push for that before you embark on a strike.
No. I needed to let you know. You remember I told you that the agreement was that we will have the payment for 3 months start. And then subsequently, before the end of the 3 months, we'll have a meeting to review what the payment for another 3 months will be. And then eventually we'll have a permanent hazard allowance after the 6th month. So we have concluded the first 3 months. We've not had a review meeting for another 3 months. We are almost rounding up July now. So what would you think will happen at the end of July, which we have already worked for? We have not reached any agreement. So we will just assume that it is status quo. That's for what is obtainable for the first 3 months will apply for the 4th month, which we are almost rounding up. So we are thinking it's in the interest of government that we meet now and conclude on what is the status of the COVID hazard allowance as we move forward, so that we do not get to a point where we'll be discussing what has happened in the past and we will not be able to reach an agreement. We are more concerned about the life insurance, more concerned about that than the hazard allowance, which it appears is monetary. But even the the life insurance itself is also monetary. So we're more concerned about that because it involves life and death. The extent to which they address the life insurance has not been any different from what has been obtainable in the past. What they did was simply pay insurance companies. And so paying insurance companies mean nothing to us. They have always been paying insurance companies for the past 10 years. What's important to us is that the next of kin of our deceased member eventually gets their money. And year in, year out, insurance premium is paid to these insurance companies on our behalf. So I keep wondering, how do you get to communicate with this insurance company? Who do you tell them you are paying for? I mean, you've never insured, or you've not enrolled us. We don't even have insurance number. We don't know which insurance company that we should hold responsible should anything happen. Yet you are making payments on our behalf. And then how do you communicate with the insurance companies, and what do you tell them you are insuring? So there's a lot of things that needs to be ironed out before we know that there's sincerity and there's commitment in addressing this issue of group life insurance. So as far as we are concerned, simply and merely paying insurance company means nothing to us. In fact, I consider it fraud, and I consider it a measure just to hoodwink us into believing that something is done with regards to the group life insurance. And we keep losing our members, and we think that is very important that it is addressed at this point in time, and we're not getting the appropriate response.
Listening to you, one would almost conclude that you have a very logical reason to embark on a strike, but some persons have described it as selfish that you would decide to go on a strike at this time during a pandemic. In fact, the Minister of State for Labour, Festus Keyamo, when I had the conversation with him, described it as blackmail. What do you make of that?
Well, I will differ from that opinion, because I will state that COVID-19 started in Nigeria sometimes in March, and if we had wanted to blackmail the country, we would have embarked on the strike when COVID was at its peak, and we never did that. And even while COVID was raging and we had plights that could necessitate and were pressing enough to make us embark on strike, we never did. We had issues of shortage of personal protective equipment, the life insurance and all of that, and we continued to engage the government until about 2-3 months after the outset of the COVID, before we eventually embarked on strike just to press home our demands. And we also need to state here that it's because of our sensitivity to the plight of the people and to the raging COVID-19 that even when government had not, we had our doubts as to the sincerity and commitment of government, we suspended the strike on mere promises. And all these are demonstration of our goodwill and our sincerity and our concerns.
While you
for
say
Nigerians.
you're trying to show goodwill and concern for Nigerians by going on a strike, I've also pointed out to you that many people might understand or almost try to see reason with you why you should go on a strike. But the pandemic is a problem, and you will agree with me that there's a huge danger in going on a strike at this time. Doctors, health workers are too important to go on a strike at this time. Have you taken into consideration the number of lives that may be lost if the strike eventually goes through? I say that because even you have attested to the fact that you've lost a doctor to strike. The reason, he wasn't attended to when he fell ill. So you've lost your own as well.
Well, we want to tell ourselves that whatever comes out of the strike eventually, the government should be held responsible. I will give you an instance. All the concerns we have before us are not concerns that cannot be addressed. And if the government, whose sole responsibility is to care for the people they lead, puts a good premium on the lives and the well-being and welfare of Nigerians, they would address these concerns that we have brought before them. And these concerns are also germane to us and also are important to our own welfare and our own well-being. And the concerns we have before the government are concerns that they can address if they are sincere and if they are committed.
Well, you don't think that this is a lack of patience on your part, considering the number of people that have waded into this issue? The National Assembly has also waded into this issue, and we've also seen talks here and there just to persuade you to at least hold on through this pandemic.
Well, I think it's not lack of patience, it's lack of commitment. The National Assembly has waded into the matter and have played their part. The other stakeholders need to play their parts. It's 5 weeks now since we last suspended our strike. 5 weeks is enough time for any serious government to address our concerns. It's not lack of patience, it's lack of commitment on the part of the government.
Very well then, let's take a moment and we'll be right back. We'll take a break, and when we return, how is the National Association of Resident Doctors reacting to some of its members jetting off to other countries in the middle of a pandemic? To stay with us. Welcome back. You're watching Hard Copy coming to you from our studios in Abuja. Dr. Aliyu Sokomba, the president of the Nigerian Association of Resident Doctors, is my guest tonight. Doctor, let's go straight to the issue of doctors leaving Nigeria. I mean, can we really say that it's fair that our doctors are leaving our country at this time, these critical times that Nigerians really need them?
Well, the concerns, the issue of doctors jetting out of this country in large droves have always been there, and every now and then more and more people are leaving this country, and that's further corroborates what we have always claimed and stood for. We have always demanded that the government of Nigeria considers health as a fundamental right, which is what it is. But unfortunately, it's not seen that way. I cannot understand how a country will invest so much in training her citizen to becoming a professional like a medical doctor and still afford to lose such a professional to other countries. According to a research that was conducted at some point by Mo Ibrahim Foundation, it's estimated that it costs an African country about $21,000 to $51,000 to train a doctor. So it's a big investment.
Which is subsidized compared to training outside this country.
Yes, so what I'm trying to say is that these healthcare workers are trained at a near tuition-free rate, and eventually when they get to become professionals, they are allowed to leave this country. What I mean by allowed is because on several occasions we have had people who are in authority stating and saying that Nigeria can afford to lose these healthcare professionals to other countries. So this calls to question how much value, how much...
What do you mean by Nigerians can afford to lose these professionals?
Yeah, we have had severally, at some point, an honorable minister of labor stating that there are enough healthcare workers in Nigeria and they can afford to leave the country to other countries. And as far as Nigeria is concerned, it's an investment that they can go out there and make more money back to the country.
But you also mentioned here that the process of training a doctor in Nigeria is highly subsidized.
Yes.
And some would expect that this would be a good time, or that could be a reason for you to pay back as a doctor.
Yes. So that's all. The desire to remain here will begin with the realization that we are needed in this country. At this point in time...
So it does appear that doctors are chasing more money.
No, it's not about money. It's about... I need to let you know, the working condition is the most important and paramount reason why doctors leave the shores of this country. We as professionals, I must let you know that Nigerian doctors are highly skilled, and their services is highly and sought for even outside the shores of this country. But it's unfortunate that as little as malaria, for those who can afford it, they have to go out of this country to get treatment, ear infection and all sorts of things. You need to go out of this country because the healthcare system in this country cannot let you practice optimally. It is demoralizing, it is depressing when you sit and stand before your patient and you need to do something and you eventually lose a patient to a death that you know is avoidable. It's demoralizing. Sometimes you don't even get to recover from such depression. And so no one wants to continue to work in an environment where he cannot give his optimal best. I mean, so we don't want to continue to work. We lost our colleague, I think about a year ago in Yenegua. I mean, we were over 100 doctors. The doctor slumped and eventually died. All we needed was a defibrillator, and the doctor was alive for over an hour. We couldn't find a defibrillator. Eventually, when the defibrillator was gotten from government house, we lost him. So of what importance are we? Why are we doctors if we cannot even save our colleagues? So these are some of the plights, some of the things we go through every day in our places of work. You work and you're a doctor, you're just near useless doctor who cannot offer your care. Those people who seek care outside this country will attest to you that most of the people that get to attend to them are Nigerians. So what we are saying is that the government needs to address the weak health system so that we will be able to do what we are trained to do. If we cannot do it here, let's go to where we can do it.
It would seem that your fight is with the federal government. I don't know the level of engagement you have with state governments, because we know that healthcare is not restricted to the federal government. And
yes.
As a matter of fact, the state government seems to have a bigger role to play in the development of the health sector.
Yes, we have not excluded the state government in our pursuit for better healthcare system in the country. We have continued to engage even the state government at the level of the Nigerian Governors Forum, and we have at several instances pressured the state government. As I speak with you now, I think the Delta State Nigerian Medical Association had embarked on industrial action to press home their demands for better healthcare delivery in the state. So the state governments have never been excluded in our pursuit for better healthcare delivery in Nigeria.
While doctors have their own complaints, there have been accusations against doctors, especially those in public hospitals or under the employment of the government, that they have, to an extent, abandoned their responsibilities, abdicated those responsibilities to nurses because they probably attend to their own private hospitals or they work for other private hospitals.
Well, they probably have abdicated their responsibility, but not to nurses. I must say that the doctors and the nurses are trained differently, and they all have different what do you call it? They have different services to offer. So, well, I quite agree with you that in every profession there are people who have failed to meet up with their expectations as professionals that they are. I will enjoin the government to take the necessary action in addressing some of these shortcomings of these doctors that have abdicated their responsibility, and to take up another responsibility privately. I think the government needs to take stern action against those who do this, engage in this practice. But I must tell you that these people that do engage in this are very few, and I will also join every well-meaning Nigerian that serious actions be taken against those who are involved in abdicating their responsibility, so that it can serve as deterrent for those who intend to follow that path.
Is it beyond the purview of the National Association of Resident Doctors?
Well, the National Association of Resident Doctors have been playing her part, but I think it should go beyond the Nigerian Association of Resident Doctors trying to address this. There are other stakeholders. The Medical and Dental Council of Nigeria should also come on board, and several other agencies that are concerned with the regulation of medical practice should also be involved in this fight against abdication of responsibility.
Now, there are those who say that Nigeria's health ministry should regulate the sector by, making laws prohibiting some of these doctors from giving their services elsewhere for at least 5 years. Do you think that's a proposition that could work?
Well, I think the National Assembly that's responsible for making laws can consider that, invite stakeholders, and whichever, so that we can all look at the pros and cons of whichever proposition that we think will strengthen the health system in Nigeria. So if that proposal is on ground, it should be tabled before the stakeholders so that the pros and cons of it will be looked into. As far as we are concerned, whatever policy that will strengthen the health system of Nigeria is implemented in this country, we will welcome it.
I'd like to know your assessment of the fight against COVID-19 so far as a doctor.
So at this point, what we are getting more is from the government. The daily briefing and all of that is government and government officials. We have severally approached the Ministry of Health to see how we can be incorporated into this risk communication campaign, and severally we are relegated and all of that. So I'm not saying this because I want to be involved. I'm saying because whatever measure that needs to be taken to help contain the disease should be taken. So I think government needs to involve other stakeholders.
Doctor,
thank you very much.
Thank you. Dr. Ali Sokomba, thank you so much for finding time to come speak with us on Hard Copy.
Thank you very much for having me.
Dr. Ali Sokomba is the president of the National Association of Resident Doctors. Well, that's Hard Copy tonight, but we want to hear from you. So send us a message to hardcopy@channelstv.com or tweet at @CTVHardcopy. If you miss any of the episodes, do go to our website, channelstv.com, or listen to our podcasts on channelstv.com/podcasts. Thank you for watching. I'm Terry Ikumi. Goodbye.